You ever just stop and think about all the stories and ideas out there? I mean, just the sheer number of conversations swirling around us
Yeah.
every single day. It really is kind of mind-boggling.
It is. It's a vast universe of knowledge just waiting to be explored.
And that's what we try to do here on the All Sorts podcast.
Yeah.
Yeah. On YouTube,
It's true.
we try to provide you with a way to explore all these fascinating topics.
Absolutely.
So if you haven't already, you should totally hit that subscribe button over on our YouTube channel.
Yeah, get on board.
That way you won't miss out on any of our future deep dives into all sorts of things.
All sorts.
And if you're enjoying what we do here, please consider sharing the podcast with your friends.
Yeah, spread the word.
Let them in on the fun, too.
Let's make this a galaxy-wide phenomenon.
You can find us on all the usual social media spots, too.
Yeah.
X, Instagram Threads.
We're everywhere.
So come hang out with the All Sorts podcast community.
It's a great crew.
Okay, so in today's deep dive, we're going to be taking a close look at a medication called Risperidone.
Risperidone. Yep, that's the one.
We're going to explore how it works in the body, what it's used to treat, and some of the effects it can have, both the good and the not so good.
The good, the bad, and the ugly of risperidone. That's what we're here for.
For this deep dive, we've pulled information from several different sources to give us a really well-rounded perspective. We've got the official prescription information, of course,
The nitty-gritty details.
drug monographs from reliable sources,
The deep dive material.
information from trusted medical websites,
The stuff you can trust.
and even a little bit from Wikipedia, just to make sure we're not missing anything.
Gotta cover all the bases.
We're on a mission here to really break down the key information about risperidone
Mission accepted.
so that you can understand why someone might be prescribed this medication, how it affects the body, and what potential effects it might have.
We aim to inform and empower our listeners.
So let's start with the basics. What exactly is risperidone?
Well, to put it simply, risperidone is a medication you can only get with a prescription from a healthcare professional.
Okay, so not something you can just pick up over the counter.
Nope, definitely not. It's a pretty powerful drug, so it needs to be carefully monitored.
Makes sense. And you were saying earlier that it comes in several different forms, right?
Oh, yeah, definitely. It comes in tablets, both regular and the kind that dissolve in your mouth super fast.
Oh, like those melt-in-your-mouth ones.
Exactly. And there's also a liquid form you can drink. And for certain situations, specifically schizophrenia, it's also available as an injection.
So doctors have options depending on the person's needs and preferences.
Exactly. It's all about finding the best fit for each individual.
And I think I remember reading that risperidone has been around for a while, which means there are generic versions available.
You got it spot on. Generic versions have been around for quite some time, which is good news for people looking for a more affordable option.
Yeah, that's always a plus. And in terms of how it's classified, is it considered an antipsychotic?
It is indeed. Risperidone is classified as an atypical antipsychotic. Sometimes it's called a second-generation antipsychotic. It's also considered an anti-manic agent, meaning it can help manage episodes of mania, which is a state of heightened energy and mood that can sometimes be problematic.
I see. So it has a couple of different classifications there. And I know we came across a bunch of brand names associated with risperidone. Would you mind running through those again, just so people are familiar?
Sure thing. Some of the brand names you might see out there are Risperidol,
Okay.
Risperidol constipaceris, Rakindo,
Gotcha.
Izadini-Risven, and Rispolept.
Vispolept, okay.
These are all essentially the same medication with the same active ingredient, risperidone, just packaged and marketed under different names.
So someone listening might be thinking, okay, I've got all these brand names down, but how does this medication actually work? What's going on in the brain when you take risperidone?
That's where things get really interesting. Risperidone mainly works by interacting with these chemical messengers in the brain called neurotransmitters.
Neurotransmitters, okay.
Yeah. The two main ones it affects are dopamine and serotonin. And these neurotransmitters basically act like signals that brain cells use to communicate with each other.
Right, they're like the brain's little messengers.
Exactly. And what risperidone does is it acts as an antagonist at various receptor sites for these neurotransmitters.
So it blocks those signals in a way.
Yeah, you could think of it that way. It essentially prevents those neurotransmitters from binding to their receptors and doing their usual thing.
Interesting. And you mentioned serotonin and dopamine. Are there any specific types of receptors that risperidone has a stronger affinity for?
Absolutely. It turns out risperidone has a really high affinity for serotonin type 2 receptors, also known as 5-HT2 receptors.
5-HT2.
And specifically for some subtypes of these receptors, 5-HT2A, 5-HT2B, and 5-HT2C, it acts as what's called an inverse agonist.
An inverse agonist.
Yeah.
So it doesn't just block, it actually does the opposite of what serotonin would normally do.
You got it. That's exactly what an inverse agonist does. It not only prevents serotonin from binding, but it can also trigger an effect that's opposite to what serotonin normally does at those receptors.
Wow, that's pretty powerful. And what about dopamine? You mentioned it affects dopamine as well, right?
Right. So risperidone also binds to dopamine D2 receptors, but it doesn't have quite as strong a grip on them as it does on the 5-HT2 receptors. It's also an antagonist at the D1 family of dopamine receptors, which includes D1 and D5 receptors.
D1 and D5, okay.
But it's much more selective for those D2 receptors. It really seems to prefer them.
So it's not just a simple on-off switch. It has these different levels of interaction with different types of receptors.
The brain is complex, and risperidone's actions reflect that complexity.
It's fascinating, really. And it sounds like risperidone doesn't limit itself to just serotonin and dopamine receptors. Does it affect any other neurotransmitters?
You're right. It actually also interacts with other neurotransmitters by acting as an antagonist at alpha-1 adrenergic, alpha-2 adrenergic, and histaminergic receptors, the H1 and H2 specifically.
Okay, those are some new ones for me.
They're all part of this intricate communication network in the brain.
And then there were a couple of others that you mentioned it has either moderate or weak affinity for.
Right. It has a moderate affinity for some of the serotonin type 1 receptors, 5-HT1A, 5-HT1B, and 5-HT1D, where it acts as an antagonist. And it has a weaker affinity for dopamine D1 receptors, again, blocking their action.
So if we're keeping score here, it sounds like risperidone is mainly blocking the action of a whole bunch of different neurotransmitters.
In a nutshell, yeah. But it's important to remember that this blocking action isn't necessarily a bad thing. It's this ability to modulate these neurotransmitter systems that seems to make it helpful in treating certain mental health conditions.
That makes sense. So it's not just about shutting things down, but more about finding a better balance.
Exactly. It's all about fine-tuning those brain circuits.
Okay, and I just want to be sure I understood this correctly.
Yeah.
You said that risperidone has negligible affinity for muscarinic beta-1 adrenergic and beta-2 adrenergic receptors. Does that mean it basically just ignores those receptors?
Yeah, pretty much. Its interaction with those receptors is so minimal that it's not really considered a major player in how risperidone works its magic.
So we've talked about all these different receptors that risperidone can bind to, but how does all of that translate into treating something like schizophrenia? What's the thought process there?
Well, one of the leading theories is that risperidone helps to reduce the overactivity of dopamine in a specific pathway in the brain called the mesolimbic pathway.
I've heard of that pathway before.
Yeah.
It's involved in emotions and motivation, isn't it?
It is indeed. So it makes sense that if you can kind of dampen down the dopamine activity in that pathway, it could help with some of the symptoms of schizophrenia.
Like hallucinations or delusions?
Yeah, exactly. Those kinds of symptoms. And the way risperidone blocks serotonin, particularly at the 5-HT2A receptors, that also seems to be pretty important for its antipsychotic effects.
So it's not just dopamine, it's a combination of effects on different neurotransmitter systems.
It's a team effort for sure.
And I remember reading that this serotonin antagonism might be one of the reasons why risperidone has potentially fewer movement-related side effects compared to some of the older antipsychotic medications.
That's a really important point. The older medications focused almost exclusively on blocking dopamine.
Right. And that often led to some pretty unpleasant side effects.
It did. And while risperidone can still cause those side effects, they seem to be less common, especially when it's used at lower doses.
So it's a more targeted approach in a way.
That's a good way to put it.
Now, besides those main actions on dopamine and serotonin, are there any other interesting things that risperidone does at the biochemical level?
Well, for one thing, it can inhibit an enzyme called D-amino acid oxidase, or DAAO,
Okay.
which plays a role in breaking down certain neurotransmitters. And at the concentrations that risperidone usually reaches in the body during treatment, it can also mess with these things called voltage-gated sodium channels.
Voltage-gated sodium channels, those ring a bell. They're involved in how nerve cells communicate, right?
You got it. And when risperidone messes with those channels, it can further alter nerve cell activity.
So it's really a multifaceted medication with all these different effects happening simultaneously?
It definitely keeps things interesting for us pharmacologists.
Okay, so now we've got a pretty good handle on what risperidone is and how it works. Let's shift gears a bit and talk about why someone might be prescribed this medication. What are its main uses?
So the primary uses for risperidone are for treating schizophrenia. It can be used both for managing acute episodes of the illness when symptoms are really intense.
Like during a psychotic break?
Exactly. And it's also used for long-term maintenance to try and prevent those symptoms from coming back.
Kind of like a preventative measure?
Yep, you could think of it that way.
I see. And is there any evidence that it's more effective than some of the older antipsychotics?
Well, research suggests that it might be more effective than most of the first-generation antipsychotics.
The older ones.
Right. But there's one possible exception, which is haloperidol. That one seems to hold its own in some cases.
Interesting. So it's not a clear-cut winner across the board?
Not necessarily. And when it comes to preventing relapses in schizophrenia, risperidone seems to be pretty good. But medications like olanzapine and clozapine might have a slight edge in that department.
Okay, so it's good to know how it stacks up against the competition. So we've got schizophrenia as a primary use.
Yeah.
What else is risperidone prescribed for?
It's also approved for treating bipolar disorder, specifically for managing episodes of mania.
Mania, okay.
And those mixed states where someone might be experiencing symptoms of both mania and depression at the same time.
Oh, wow. That sounds really challenging to deal with.
It can be. And risperidone can be helpful in stabilizing mood in those situations.
I see. And I think I remember reading that risperidone is sometimes used in children and adolescents with autism spectrum disorder. Is that right?
That's right. It's specifically used for treating irritability in children and adolescents with ASD.
So we're talking about things like aggression, self-injurious behaviors.
Yeah, all of that. Challenging behaviors, rapid mood changes, those kinds of things.
It sounds like it could be a real game changer for families who are struggling with those kinds of behaviors.
It can be. But it's important to note that it's usually recommended only when the behavioral issues are pretty severe and when other approaches haven't really worked.
So it's not typically the first-line treatment?
Not usually. And you always have to carefully weigh the potential benefits against the possible side effects, especially in kids whose brains are still developing.
That's a good point. You also mentioned something earlier about off-label uses of risperidone. Could you explain what that means?
Sure. So off-label use basically means that a medication is being prescribed for a condition that hasn't officially been approved for by regulatory agencies like the FDA.
So it's not necessarily that it's wrong or dangerous to use it that way. It's just that it hasn't gone through the full approval process for that specific use.
Right. It might be that there's not enough research evidence yet to support its use for that condition, or that it's still being studied.
Okay, that makes sense. So what are some common off-label uses of risperidone?
One common one is using it as an add-on treatment for people with depression who haven't responded well to standard antidepressants.
This is like giving the antidepressant a little boost.
Exactly. It's called augmentation. And it's also sometimes used for obsessive-compulsive disorder when those first-line treatments haven't been effective.
Interesting. And I think you mentioned a couple of others too.
Oh, yeah. It can also be used to help manage aggression that might be associated with ADHD or other mental health conditions.
So it's not just for aggression related to autism.
Nope. It has a broader application there, and it can also be used to address psychosis and agitation in folks with Alzheimer's dementia.
Okay, so it sounds like risperidone is a pretty versatile medication with a range of approved and off-label uses.
It's definitely a busy little drug.
Now let's talk a bit about the practicalities. How is risperidone actually given to people and in what doses?
Well, as we mentioned earlier, it comes in several different forms, and the specific dose and method of administration really depend on a bunch of factors, the condition being treated, the person's age, and how they respond to the medication. We've got tablets regular and the orally disintegrating kind.
The ones that dissolve quickly.
Yep. We've got the liquid solution and then the long-acting injectables.
The injectables, let's dive into those a bit more. I know some medications have different types of injections that last for different lengths of time.
You're absolutely right. For risperidone, the injectable forms are primarily used for treating schizophrenia, and they're typically given either intramuscularly or subcutaneously.
Intramuscularly so. Into the muscle.
Right, and subcutaneously just means under the skin.
Okay, I got it.
So the intramuscular injections like Risperidone, Consta and Risvan, those are usually given every 2 weeks or sometimes once a month.
So they last a while?
They do. And often when someone starts on one of these injections, they'll also need to take oral risperidone for a little while to make sure they're getting a consistent level of the medication.
Sort of like a bridge between the oral and the injectable forms.
Exactly. And the specific way they start those injections can vary a bit depending on which brand they're using and what dose of oral risperidone they were taking before.
I see. And then you mentioned subcutaneous injections. What are those like?
Those are given less often, usually once a month, or for UZD even every 2 months.
Wow. So even less frequent than the intramuscular ones.
Yep. And with the subcutaneous formulations, it's generally not recommended to start with oral risperidone beforehand.
So it's a different protocol altogether.
Exactly. Different strokes for different formulations, you could say.
So we've talked about the injectables.
Mhm.
What about the oral forms, the regular tablets, and the liquid? What kind of doses are we talking about there?
So for oral risperidone, the dosage can vary quite a bit. It really depends on what's being treated.
Okay.
For schizophrenia in adults under 65, a typical starting dose might be around 2 milligrams per day, and the goal is often to reach somewhere between 4 and 6 milligrams per day.
So they might gradually increase the dose over time.
Exactly. It's all about finding that sweet spot where the medication is effective, but side effects are manageable.
Makes sense. And can they take that total daily dose all at once, or do they need to split it up?
It can be taken all at once or divided into 2 doses throughout the day, whatever works best for the individual.
And what about for older adults? Are the doses typically lower?
They usually are. For
Yeah.
folks over 65 with schizophrenia, the starting dose might be more like 0.5 milligrams twice a day.
Okay, much lower.
And then they can gradually increase it up to 1 or 2 milligrams twice a day.
And what about for someone with bipolar disorder who's experiencing mania?
For adults under 65, the starting dose is usually a little bit higher than for schizophrenia, often around 2 to 3 milligrams per day, and that can go up to a max of 6 milligrams per day.
Gotcha. And for children and adolescents with autism who are prescribed risperidone for irritability, how are those doses determined?
In those cases, the doses are very carefully calculated based on the child's weight.
So it's not a one-size-fits-all approach.
Definitely not. Especially when it comes to kids, you really have to be super cautious with dosing.
It sounds like finding the right dose for someone involves a lot of individual fine-tuning. Are there any other things doctors take into consideration when deciding on the dosage besides age and the condition being treated?
Oh yeah, absolutely. One big one is how well the person's kidneys and liver are functioning.
Ah, right, because those organs are involved in processing and eliminating medications.
Exactly. So if someone has kidney or liver problems, they might need a lower dose to prevent the medication from building up in their system. And as we talked about before, it's generally a good idea to see how someone tolerates oral risperidone before they start on any of those long-acting injections.
That way, if they have any side effects, you can catch them early and maybe adjust the dose or switch medications.
Precisely. It's always better to be safe than sorry.
Okay, so now let's talk about some of the things people should be aware of before they even start taking risperidone. Are there any situations where it might not be a good idea to take this medication?
Yeah, there are definitely some things to consider. First of all, if you've ever had an allergic reaction to risperidone or any other medication, obviously you shouldn't take it.
Right, that's pretty basic.
Common sense, but important to mention. And then there are certain health conditions that need to be carefully considered. If someone has heart problems, particularly irregular heartbeats or arrhythmias,
Okay.
or low blood pressure, those are red flags.
So those would require a discussion with their doctor to see if risperidone is safe.
Definitely. And if someone's had a stroke or is at high risk for stroke, that's also something to take into account.
And what about any history of movement disorders? I know risperidone can sometimes cause movement problems, so would a pre-existing movement disorder be a concern?
Absolutely. If someone has a history of problems controlling movements of their tongue, mouth, and face,
Like with tardive dyskinesia?
yeah, that's one example. Or if they've ever had a condition called neuroleptic malignant syndrome.
I think you mentioned that earlier.
Yeah, it's pretty rare, but it can be serious. It involves a super high fever, muscle stiffness confusion.
That sounds really scary.
It can be. So in those cases, risperidone might not be the best option.
Makes sense. And what about Parkinson's disease or dementia? Are those conditions that might raise concerns?
Yes, unfortunately for folks with Parkinson's or certain types of dementia, there's an increased risk of some pretty serious complications, including an increased risk of death in older adults who have psychosis related to dementia.
Wow, so risperidone is generally avoided in those situations.
Yeah, it's just not worth the risk.
Are there any other health conditions that would warrant a discussion with the doctor before starting risperidone?
Yep, a few more.
Yeah.
A history of low white blood cell counts is one, diabetes or epilepsy, because risperidone can sometimes affect blood sugar control, and it can potentially lower the seizure threshold.
Okay, so those are important to consider.
And if someone's ever experienced a really prolonged or painful erection?
Like priapism.
Exactly. That's a serious condition that needs to be addressed immediately. And any issues with controlling body temperature or a tendency to overheat kidney or liver problems, which, as we discussed, might mean needing a dosage adjustment, a personal or family history of blood clots, those are all important factors to consider.
It's a lot to keep track of, but it really highlights how crucial that conversation with the doctor is before starting any new medication.
Absolutely. It's all about being informed and making sure the medication is the right fit for you.
And what about pregnant women or women who are breastfeeding? Are there any special precautions there?
When it comes to pregnancy, the safety of risperidone hasn't been totally nailed down yet. There's some concern that it might cause problems for the baby if it's used later in pregnancy.
So it's best to err on the side of caution there.
Exactly. And there's actually a national pregnancy registry for atypical antipsychotics that women can join if they want to help researchers learn more about the safety of these medications during pregnancy.
That's interesting. So they can contribute to the research while also getting information and support.
Exactly. And as for breastfeeding, it's really important to talk to your doctor to weigh the potential risks and benefits because risperidone can pass into breast milk.
So it's a case-by-case decision based on the individual circumstances.
For sure.
Okay, so we've talked about the situations where risperidone might not be the best choice.
Mm.
Now let's get into some of the potential side effects that people might experience while taking this medication.
All right, let's do it. So the common side effects, the ones that might affect up to 1 in 10 people,
Okay.
those can be all over the map. One of the most frequent ones is feeling sleepy or having trouble falling asleep.
It's kind of like drowsiness.
Yeah, or just feeling more tired than usual. And then there are movement problems. Those are pretty common too. They can show up as dyskinesia.
Dyskinesia, is that like stiff muscles or a shuffling walk?
Yep, those are some examples. It can also cause tremors or shakes, drooling, and this feeling of restlessness, like you can't sit still. That's called akathisia.
So basically a whole range of movement-related issues.
Unfortunately, yeah. Headaches are also pretty common, and then there's the weight gain issue that a lot of people are concerned about.
Yeah, that's often brought up with these types of medications. Is weight gain a common side effect of risperidone?
It definitely can be, and it often comes with changes in appetite too, usually an increase in appetite.
So you might find yourself feeling hungrier than usual.
It happens. And then there are the gastrointestinal side effects. Those are no picnic either. You might get stomach pain, nausea, vomiting, constipation, diarrhea, indigestion, just general abdominal discomfort.
Oh man, that sounds rough.
Yeah, it's not fun. And then you can also get dry mouth, or the opposite too, like excessive saliva production.
Interesting. So it can go either way with the saliva.
Yep. The body's a strange and wonderful thing.
And I think I remember reading about some potential hormonal effects as well.
Oh, yeah. Risperidone can mess with your hormones a bit. It can cause swollen breast pain, and even leakage of breast milk.
Wait, really? In men too?
It can happen.
Yeah.
It's because of changes in prolactin levels, a hormone that's involved in milk production.
Wow, that's wild. And you said it can even affect kids.
Yeah, it can sometimes lead to the development of breast tissue in children, a condition called gynecomastia.
Okay, so definitely something to be aware of. And are there any other common side effects we should mention?
A few more: blurred vision, anxiety, agitation, insomnia.
Insomnia, but I thought you said it could cause drowsiness too.
Yep, it can be kind of a double-edged sword there. It can make you sleepy, but then also make it harder to sleep once you are sleepy.
Oh man, that's frustrating.
It can be. And then you've got nasal congestion, runny nose, sore throat, basically your typical cold symptoms.
So like a case of the sniffles.
Yeah, pretty much. And then dizziness, fatigue, and rashes, those are all fairly common too. And if you're getting risperidone as an injection, you might have some pain around the injection site in your arms, hands, legs, or feet.
Okay, so that's a pretty extensive list of potential common side effects.
Yeah.
What about the more serious ones, the ones that are less likely to happen?
All right, so the serious side effects, those thankfully tend to be less frequent, meaning they affect fewer than 1 in 1,000 people.
Okay, so much rarer.
But it's still really important to be aware of them because they can be, serious. One of those is involuntary twitching or jerking movements, especially in the face, tongue, or body.
So those would be like uncontrollable movements.
Exactly. And then there's the risk of blood clots, which can be super dangerous. Signs of a blood clot might include swelling pain and redness in one leg or chest pain combined with difficulty breathing.
Those sound like emergency situations.
They are. If you experience any of those symptoms, you need to get medical help ASAP.
Noted. And then we talked earlier about neuroleptic malignant syndrome as a potential reason to avoid risperidone, but it can also be a serious side effect, can it?
That's right. If someone develops symptoms like a very high fever, severe muscle stiffness, sweating anxiety, and excessive saliva production, that could be NMS. And
NMS.
it's a medical emergency.
So again, immediate medical attention is needed.
Absolutely. And then there are some other serious side effects that can happen, like a sudden weakness on one side of the body, trouble speaking, or thinking clearly, a loss of balance, or changes in vision.
Those sound like stroke symptoms.
They could be. So if you experience any of those, seek medical help right away.
Okay, another one for the emergency list. And are there any other serious side effects we haven't covered yet?
Yeah, a few more. A really fast heartbeat, difficulty breathing seizures or fits. A painful erection that lasts for more than 2 hours, which is called priapism. That's a medical emergency too.
So those are all pretty scary and definitely warrant a call to the doctor.
Right. And then there's some serious side effects that can affect mental and emotional state too. Things like thoughts of suicide or self-harm, a worsening of mood, or the development of feelings of depression.
So it's not just physical side effects you have to watch out for.
Nope, mental and emotional changes are important to monitor as well.
And what about those movement disorders you mentioned earlier, like tardive dyskinesia?
So if someone starts experiencing uncontrolled and repetitive body movements, severe muscle stiffness or spasms, persistent tremors or shaking loss of balance or coordination, ongoing restlessness, or a shuffling walk,
Okay, those all sound pretty alarming.
they can be. Those could be signs of more severe extrapyramidal symptoms, or even tardive dyskinesia, which is a potentially permanent movement disorder.
Permanent, that's terrifying.
It's definitely a serious concern. And then there are some metabolic side effects to be aware of too, like dangerously high blood sugar levels.
Okay, so risperidone can affect blood sugar.
It can. It can even lead to the development of diabetes or a related condition called ketoacidosis. And then surprisingly, sometimes it can cause very low blood sugar levels too.
So it's important to keep an eye on blood sugar levels if you're taking risperidone.
Absolutely. And there are a few other less common but still serious side effects, like a prolonged QT interval on an EKG.
That's something that shows up on a heart tracing, right?
Yep, and that can increase the risk of serious heart rhythm problems.
So those are definitely things you'd want to catch early on.
For sure. And then we've already talked about the increased risk of death in older people with dementia-related psychosis, a very low white blood cell count, which is called agranulocytosis seizures, a sudden drop in blood pressure when standing up, which is called orthostatic hypotension sleep apnea syndrome, and problems with retaining urine. Those have all been reported too.
So it's a mixed bag with the serious side effects, some affecting the body, some affecting the mind.
It's a reminder that medications, even those that can be very helpful, can also have potential downsides.
Absolutely. So with all these potential side effects, are there any general tips for managing the more common, less severe ones?
Well, there's some things you can do to try to minimize those pesky side effects. For drowsiness or sleepiness, it's important to avoid driving or operating machinery until you know how the medication affects you.
Right, because you don't want to be nodding off behind the wheel.
That would be bad. And sometimes that drowsiness tends to lessen over time as your body adjusts to the medication.
Okay, so it might just be a temporary thing.
Hopefully. And if you're having movement problems, it's crucial to talk to your doctor because they might need to adjust your dose or consider a different medication altogether.
So don't just suffer in silence.
Definitely not speak up. For headaches, those can often be managed with rest hydration and over-the-counter pain relievers.
Like ibuprofen or acetaminophen?
Yep. But if they're severe or if they just don't go away, you should definitely check in with your doctor.
And what about the weight gain issue? That could be a tough one to manage.
It can be, but focusing on a healthy diet with portion control and getting regular physical activity can definitely help.
So it's about making those lifestyle changes.
Exactly. And if you're having stomach upset like nausea or indigestion, try eating smaller, more frequent meals and avoiding rich or spicy foods.
That makes sense. And what about constipation?
Increasing fiber and fluid intake and staying active, those are good strategies for constipation. And if it's diarrhea you're dealing with, make sure you're staying hydrated and avoid taking any other anti-diarrheal medications unless your doctor gives you the okay.
So those can interfere with the risperidone.
They can. And if you notice any breast changes, it's important to discuss those with your doctor, especially if they're persistent or bothersome.
That's a good reminder. Yeah. And I guess the bottom line is if any side effects are really bothering you or if they just don't seem to be getting better, you should always reach out to your doctor.
Absolutely. Communication is key when it comes to managing medications.
Now, we've talked about how risperidone can cause some side effects, but what about potential interactions with other medications? Are there any significant ones people should be aware of?
Oh, yeah. Risperidone can definitely interact with other medications, which is why it's so important to tell your doctor and pharmacist about all the other medications you're taking.
Right, even over-the-counter stuff and supplements.
All of it.
Yeah.
They need the full picture to make sure there are no dangerous interactions.
So give them the whole laundry list.
Exactly.
Okay.
So, for example, rifampicin, which is an